Today we're diving into a huge shift that's happening in one of the most personal areas of our lives, our health. We're going to unpack the big debate between seeing your doctor through a screen versus showing up in the office and really figure out what it all means for you.
I mean, just think about that for a second. A full-on medical consultation from your living room couch. What felt like pure science fiction just a few years ago is now a daily reality for millions of people. But the real question is, can this new level of convenience actually replace the traditional doctor's visit we've trusted for generations?
So here's how we're going to break it down. First, we'll look at the two big models of care. Then we'll compare them on access, quality, and cost. We'll hear from actual patients and doctors on the front line. And finally, we'll explore how a hybrid solution might just be the best path forward for all of us.
All right, so to really get what's going on, we first need to get a clear picture of the two major players at the heart of this entire transformation.
First up, you've got telemedicine. Now, what we're talking about here is basically using technology, your phone, an app, your laptop, to connect with a doctor for a consultation. It's healthcare delivered digitally, pretty much whenever and wherever you need it.
And on the other side of the ring, you've got traditional care. This is the one we all know. You book an appointment, you travel to the clinic, you sit in the waiting room, and you have a direct face-to-face examination with a doctor.
Okay, so how do these two actually stack up against each other? We're going to put them head-to-head on three really critical points. How easy is it to get care? What's the quality of that care? And of course, what's it going to cost you?
Let's kick things off with access. With telemedicine, the connection can be almost instant. You can be talking to a doctor in just a few minutes right from home. Compare that to traditional care, where you might be waiting days, or let's be real, sometimes even weeks, just to get in the door.
And look, this convenience isn't just some nice-to-have luxury. For a lot of people, it's an absolute necessity. Get this, a massive 85% of people living in rural areas say they prefer telemedicine. For them, it's not just about saving a bit of time on the road. It's a total game changer for getting care that used to be hours away.
But convenience is only part of the equation. When we start talking about quality, a really interesting trade-off emerges. For something straightforward, like a common cold, telemedicine does a pretty good job. But when things get more complicated, the data shows that an in-person exam is way more accurate. That physical, hands-on assessment is still the gold standard.
And finally, let's talk about the big one, money. The difference here is pretty shocking. A telemedicine call might set you back as little as $20. An in-person visit? That can easily hit $200. And that's before you even think about the cost of gas, parking, and taking time off work. It's a clear win for telemedicine when it comes to your wallet.
Okay, so numbers and data are one thing. But how does this all feel to the real people, the patients and doctors who are living this every single day? Let's hear from them.
You hear a story like Nora's, and the benefit is just crystal clear. For her, telemedicine is a total lifeline. It means her mom gets the consistent care she needs without the exhaustion and stress of constant travel. It's a small change in technology that makes a world of difference in their lives.
But that's not the whole picture. You listen to someone like Ali, and you get a completely different take. He's speaking for so many people who feel that a screen just can't replace a real presence. For him, that reassurance of a doctor actually physically examining him is priceless, especially when he's feeling really unwell. And it's not just patients who are divided. Doctors are too. You have Dr. Yasser, a psychiatrist, who finds that seeing patients online makes him way more efficient. He can potentially connect with and help more people in a day. For his field, it's a powerful tool.
But then, an orthopedist like Dr. Samira brings us right back down to earth with a sharp dose of reality. Her point is so simple and so powerful. There are just some things you can't do through a screen. You can't feel for a broken bone or check a joint's mobility over a video call. It's a perfect example of the hard limits of this technology.
So, you've got this clear divide, right? One side offers incredible access and savings. The other offers unmatched precision. But what if we didn't have to choose? What if the answer is to combine the best of both? This is where the hybrid solution comes in. So the hybrid model isn't about one replacing the other. It's about smart integration. It's about using the right tool for the right job. You use telemedicine for what it's great at: quick check-ins, follow-ups, managing prescriptions. And you save those crucial in-person visits for what they're best for: complex exams, physical procedures, and building that vital doctor-patient trust.
So what would that actually look like for you?
Well, imagine you start feeling sick. Your first step is a quick video call with a doctor. If they think they need a closer look, they'll schedule you for an in-person visit for labs or an x-ray. But then, instead of you having to drag yourself back to the clinic, you just hop on another quick video call to go over the results and plan the next steps. It's seamless, it's efficient, and it's built around your life.
And here's the kicker. This isn't just about making things nicer for patients. It's a genuinely smarter way to run the whole system. The data shows that hospitals that have gone hybrid see a pretty amazing 25% increase in their return on investment. This proves the model isn't just a feel-good idea, it's financially smart too.
So, after all that, where does this leave us? Well, we are standing right at the edge of a brand new era in healthcare, one that's being forged right now by this exact debate.
The big takeaway here isn't that one side wins. The future of our health isn't about choosing telemedicine or traditional care. It's about embracing telemedicine and traditional care. It's a future that harnesses the incredible efficiency of digital tools while fiercely protecting the irreplaceable value of the human touch.
And that leaves us with one last massive question to think about. We can see what a better, more balanced system could look like, but is our healthcare infrastructure, from the policies and insurance rules all the way down to the mindsets of doctors and patients, is it truly ready for this hybrid future? That's the challenge that lies ahead for all of us.